Okay, Dr. Bowling, will you tell me your official title, please?
It was Jason Bowling, Bowling. I'm a professor of infectious diseases at UT Health San Antonio and the hospital epidemiologist at University Health.
So we're seeing a little bit of a spike in measles cases. It started in West Texas and now it's kind of spread. Can you tell us a little bit about your understanding from that on the doctor side of things?
Right, measles activity. We've been fortunate and not had a lot of measles activity in Texas, and now we are seeing this outbreak in the South Plains area, which is really up in the West Texas Panhandle region. Now several counties are involved. The latest count is up to 124. I think people in Bexar County are understandably on high alert because there was a recent notice that there were some potential exposures that occurred on February 15th. And so providers are wanting to make sure that they're aware so that they recognize it if they were to see any cases of measles.
And so does that put medical professionals on high alert for what they could see if people are coming in with some concerns or maybe even symptoms?
It does. I think the providers have taken appropriate steps to know what they should be looking for. Since this isn't something that we see routinely, we're still in the window of time where there could be potential conversions. There haven't been any active cases to date in Bexar County of measles, but people don't want to miss them. And so they want to make sure that they're aware of the signs and symptoms they should be looking for.
Before, when we were seeing measles cases, in West Texas, the best thing that people were saying is to make sure that you were vaccinated. But now that it's knocking on our back door, what are some of the ways that you can treat measles, if at all, if you do happen to contract it?
The best thing that people can do is to make sure that they're up to date on their vaccines. The measles vaccine, it's recommended that people get 2 doses. And with 2 doses, it's estimated you have 97% protection, and it's thought to be lifelong immunity. So it's a very effective and very durable vaccine. Once you develop measles, unfortunately, we don't have an antiviral or a medicine or a pill that you take that makes the measles go away. It really relies on your antibodies to clear it out.
And about how long does that take from the time you get it to the time that it's completely out of your system?
Great question. So there is a window of time from when you're exposed to when you develop the disease if you're going to get infected. So generally, it's thought that the longest it could be is three weeks, 21 days. Most people get it 1 to 2 weeks after they're exposed. So there is a window of time. They start off with high fever, can be as high as 104 degrees Fahrenheit. They can have a cough, runny nose, itchy, watery eyes. That lasts for about 2 to 4 days, and then that's when they develop the characteristic rash. Starts around the hairline on the face and then it moves from the face to the body, arms, and legs. That lasts for about 7 days, about a week or so, and then it starts to fade in the order that it appeared. And then generally people are better, although they may have a lingering cough for a couple weeks afterwards.
And how quickly are you contagious from the moment that you catch it?
You're considered to be contagious from 4 days before the onset of the rash to 4 days after the onset of the rash. So there's an 8 day window where you are highly transmissible to others.
And let me start with this. Is it considered a disease or is it a virus or what's the proper way to characterize it?
Yeah, another great question. So there's a virus that causes this disease. So the measles virus is responsible, and it's this really transmissible pathogen that causes the disease measles.
And so it, do I have to do skin to skin contact? Is it airborne? How do you grab it or how do you get it?
Measles is transmitted through the air. So these tiny little airborne droplets, when somebody breathes, coughs, sneezes, it creates these tiny little air droplets that will infect about 90% of people that are unvaccinated if they're exposed. And we know that the measles virus can sit in these droplets in the air for up to 2 hours after an infected person leaves a room. So that adds another layer of complication and concern for something that's this transmissible.
And similarly with the COVID outbreak, people were saying, basically bathe in disinfectant, and keep all your spaces clean. Is disinfectant something that can stop any kind of particles from spreading?
You're not able to disinfect the air. That requires ventilation and air changes. But disinfectants readily kill the measles virus. It's easily killed by soap and water, alcohol-based hand rubs, even better. It's easier to carry around. And then standard disinfectants for cleaning surfaces are very effective.
And Dr. Bowling, we're coming up on the spring break period where there's going to be a lot of traffic all over the country. What would you suggest that people, both vaccinated and unvaccinated, do before they get to moving around?
Well, I would say the most important thing is for unvaccinated people or undervaccinated people, if someone's only had one dose of the measles vaccine, to get up to date. That's the best way to protect themselves. There's going to be movement around, a lot of travel. Even if you don't go somewhere, other people are going to be traveling, and so there's potential risks. So I think that would be the key thing for people to do.
Just Friday, the CDC reported that there were 90 cases among 7 Texas counties. Today, we're at 124 with 1 death. Are you concerned about how quickly this is kind of spreading or surging?
Believe this really reflects the high level of unvaccinated people in that county. If you look at those numbers, the other thing they reported out is that only five of those people were fully vaccinated, and that works out to about 4% of the 124 people, which is right around that estimate that 97% of people the vaccine is 97% protective. And so it is concerning. It spreads so fast, but we know measles is very transmissible, which is why it's so key that people get protected.
And another medical professional I spoke with said if you start demonstrating symptoms of having this illness, don't go into the hospital or to the doctor because you can risk passing it to more people. So if I'm starting to show symptoms of measles, what should I do?
Great question. What we want people to do is they can call their healthcare provider or call the clinic, because if they need to be seen, that way they can coordinate with that office so that they can be seen safely. They can wear a mask when they come in. They can be moved into an appropriate room so that they're not exposing everybody in the waiting room.
And assuming that somebody does just walk in, what does that look like on the medical professional side? Or is it immediate isolation, or how do you protect the rest of the patients that may be in the area?
We're working on, so one of the important things is to educate people on what they need to be doing if they themselves are sick. We're also educating our frontline staff that if they see somebody with fever, rash, or fever and a cough, they should place a mask on that person. If they have fever and rash and you're worried about measles, they need to be moved into the appropriate room in our clinic or hospital setting as quickly as possible to reduce that risk of secondary transmission.
So we've seen that this illness mainly affects young children, pregnant women, and immunocompromised people. Are there any other groups that should be on the lookout or taking the extra precautions?
Those groups are all at higher risk. Pregnant women is an important category to remember. We always think of people that are younger or very old, immunocompromised at risk, but pregnant women are also at risk. The other thing to think about is that they are at risk from everybody that could get it. So even if you don't fit into one of those categories, you could still be a vector or transmit it to somebody else, which is why it's also important that you make sure you're protected so you're not a link in the chain of transmission.
And Dr. Bowling, is there anything else that you want to say or add or just emphasize?
I think it's important that people are informed and stay aware of what's going on so that they can prepare appropriately. The best preparation, again, is to check your vaccine status to make sure that you're up to date and protected. We don't currently have any active cases in Bexar County, but obviously we need to continue to monitor this situation closely. It's a dynamic situation. And again, it's reassuring that the vaccine really is an effective tool and it has long-lasting, it's not a vaccine that you have to get year after year. It has long-lasting protection. It's very durable.
And my final question here is, what's the difference between having an active case in the area versus a confirmed case in the area? Because I believe that what we saw over the weekend was a active case for Gaines County.
That's right. So the person was found to be positive after they had traveled in the San Antonio area. We don't have any cases in our area. And so that impacts how we think about what we need to be doing, for people coming into the clinic. If we start to see active cases in Bexar County, we're going to need to be more active on surveillance, asking people questions and screening before they come to visits, things like that to reduce the risk of secondary cases. Right now, we're just needing to monitor very closely, reminding people again to check their vaccine status so they can take the steps to protect themselves.
And are there any final thoughts that you would like to add?
I think this is a call to attention of the importance of why we need to kind of use these vaccines to the best of our ability so we can keep everybody protected. It's important that the community is protected so that we can protect those people that may not be able to respond to the vaccine or receive the vaccine.